Good afternoon, everyone. My name is Janice Whitaker, and it's my pleasure and privilege to serve as the CGNE Administrator and Education Program Manager. And I welcome you to another CGNE seminar this spring. It's my pleasure to also introduce Jenny Rank. Jenny is our Education Program Specialist, and she does a lot of the planning to implement our seminars, along with Amy Caputo, our Marketing and Communications Director. This program is being presented by the Teresa Neese and Helen Diskovich Center of Geriatric Nursing Excellence at the Ross and Carol Neese College of Nursing, in collaboration with the Office of Outreach and Professional Development, the Center for Nursing Research, and Age-Friendly Care Pennsylvania. Today's seminar, Geriatric Nursing, A Brief History of a Young Specialty, will be presented by Dr. Ann Kolanowski, Professor Emerita of Nursing and Psychiatry at Penn State. She's also the founder and the original director of our center, so it's always special when Ann joins us. Before she begins, we do have some disclosures and announcements to make. Penn State Ross and Carol Neese College of Nursing is approved as a provider of nursing continuing professional development by Pennsylvania State Nurses Association, an accredited approver by the American Nurses Credentialing Centers Commission on Accreditation. Participants with a valid RN license who attend the entire nursing continuing professional development program can earn 1 contact hour. Partial contact hours are not awarded. To earn contact hours, we do record attendance through Zoom, and we do ask that RNs complete the evaluations within 1 month, within 1 week of the seminar, with certificates being mailed within a month. Just to make everyone aware, the seminar is being recorded. If you have questions and comments, and we hope you do today, that you can enter them into the chat. You can also raise your hand, and Jenny will monitor that. And then she'll unmute you so you can speak aloud to either ask a question or engage in our discussion today. When the seminar ends, the post-event link will pop up in your browser, and you can complete the evaluation at that time, or you can receive it via email within 24 hours and complete it then. This is, again, required for RNs, but we do ask that all attendees complete the evaluation. It helps us with data collection and assists us with future programming. If you ever have any questions, please feel free to reach out to cgne@psu.edu. Next, I'd like to introduce Solomon Tagbor, who is a CGNE affiliate graduate student in his first year of his PhD program. Solomon is interested in studying chronic disease management in older adults with a focus on self-care for persons living with type 2 diabetes. Thanks to Solomon for being here today and for introducing our speaker.
Thank you. Dr. Ann Kolanowski is a registered nurse and a fellow of the American Academy of Nursing, is academic professor and a professor emerita at the Penn State Ross and Carol Neese College of Nursing. During her career, she conducted research on non-pharmacological interventions for symptoms of distress and delirium in people living with dementia in nursing homes. Her research has been supported by grants from the National Institute of Nursing Research, the Alzheimer's Association, and the Hartford Commonwealth and Neuroscience Nursing Foundations. Dr. Kolanowski has published over 195 papers on dementia care in scientific journals and serves on many boards, including the Armed Services Retirement Home and the King's College Board of Directors as well as scientific advisory and consulting panels, including LinkAd, eStudy, impact of nursing home leadership care environments, and health information technology on outcomes of residents with ADRD study, evaluating novel healthcare approaches to nurturing and caring for hospitalized elders, enhance trial, and the teaching nursing home projects. She was the recipient of the 2012 Doris Schwartz Gerontological Nursing Research Award and is a fellow in the American Academy of Nursing and the Gerontological Society of America. Dr. Kolanowski was the founding director of the Hartford Center of Geriatric Nursing Excellence at Penn State University. Dr. Kolanowski, you can take it over.
Okay. Well, thank you very much, Solomon. I appreciate that introduction, and I'm just delighted to be here with my friends from Penn State and wherever else people are coming from. So let me start by sharing my screen here. Can people see that? Okay, great. All right, so the title of my presentation is Geriatric Nursing, A Brief History of Young Specialty. And I'm going to begin with a disclaimer as well as a dedication. I have no formal training or experience in historical research. I was asked to, present this, but I have been an eyewitness to a lot of what went on in geriatric nursing in the last, say, 50 years. So I am going to, focus a lot on my own experience in this presentation. I also want to dedicate this presentation to all nurses who have advanced the care of older adults. And I want to give special gratitude to Dr. Lori Gunter, an early leader in geriatric nursing that you'll hear more about. And she actually was one of the early directors of nursing here at Penn State and headed up and developed their master's program in adult health and aging. So, why is nursing history important? I think we look backward so we have a better vision for going forward. And that's really my big focus today. So I'm going to approach this presentation on the history of geriatric nursing from a very high-level examination that's going to hit some of the major high points. So I'm going to give you a bit of an overview of the social, economic, and political events that influence the development of geriatric nursing. I'm going to introduce you, if you don't already know, some of the early pioneers and their work. These are leaders after World War II, the 1950s through the 60s. Leaders from the action generation, the 70s through the 90s. And then have a summary of issues that have been very prominent in our specialty in the last half century. And then finally, and probably most important, I want to hear what you see as the most important things that we need to do as geriatric nurses to move our field forward. And so we'll have that discussion at the end. So the story of American nursing really begins around the turn of the 20th century when the profession was beginning to be established in the US. And if you'd like more information on that, there is a wonderful website at the University of Pennsylvania, their Center for Nursing History, that I really encourage you to take a look at. We're just going to focus on geriatric nursing today. So prior to the 1930s, most of the attention was on frail, poor, older adults, and a lot of attention on maternal child nursing, because that was really a huge issue at the time. Around the turn of the century, we had poor laws that set up almshouses, and they housed both the, quote, deserving and undeserving poor. And the people who worked in those institutions were often referred to as pauper nurses. They were not trained. And the care that was delivered there was quite subpar. The conditions were rather deplorable. Now, Lavinia Dock, she was the assistant superintendent at the Johns Hopkins School of Nursing. She was an early feminist, a writer, a pioneer in nursing education, and a social activist. She was one of the first to shine light on conditions in almhouses in her 1908 paper that was published in the American Journal of Nursing. The title of that paper was The Crusade for Almhouse Nursing. And she was looking at all the people that were the recipients of the, quote, care at the time. She called upon what she referred to as intelligent women to take up positions in these settings so that the, quote, I'm quoting her, the evils, all of which lie strictly in the spheres of housekeeping and nursing, lauded as women's own, might not occur, end quote. Now, in response to her plea, the American Nurses Association Board of Directors appointed an almhouse committee to oversee nursing in these institutions in 1912. But I think you all know what happened around the turn of the century. World War I really took center stage and the spotlight off a lot of what was going on in the country. And those years were 1914 to 18. So the care of older adults really took kind of a back seat at that time. But following World War I, the population of older adults in the US really started to move up. And along with the climb in population, there were a host of social and economic problems that were experienced by this very vulnerable group, especially those who did not have family to take care of them. In 1935, you'll remember from your history class, President Franklin Delano Roosevelt signed into law the Social Security Act of 1935, and this provided insurance and public assistance for older adults. Now, without question, Social Security has been a lifeline, a safety net for older adults. In fact, today, 40% of people over the age of 65 have Social Security as their only source of income. Social Security has been the major anti-poverty program in the United States. So going back at the time of its passing, Congress stipulated that these funds could not be used for almhouse care. But business people saw an opportunity to open boarding houses, which were not regulated and often delivered very poor care. They're the forerunner of today's nursing homes. During the 1940s and 50s, we saw more growth in the population over 65 years of age. And it was during this time that health professions started to step up to the plate. We saw the establishment of the American Geriatric Society in 1942 and the Gerontological Society of America in 1945. It was also at this time that the Hospital Survey and Construction Act, commonly referred to as the Hill-Burton Act, provided federal grants to states for the construction of new community hospitals. They had to be non-federal, short stay, and they needed to be operated on a nonprofit basis. This act also provided funding for the construction of nursing homes. Now, what I found fascinating in my reading for this presentation was the forward thinking of nurses at this time. 2 papers by nurses, and they're listed here. One is in the American Journal of Nursing and the other Public Health Nursing. They laid out a vision for what good geriatric nursing care should be. Remember, this is back in the beginning of the 1940s. They thought geriatric nurses should emphasize psychosocial care, health promotion, that we should have a strong presence of professional nursing in nursing homes, etc. And very interesting, they alluded to the benefits of academic practice partnerships. I think we've heard a lot about that lately and a lot about what they said, but that was the 1940s and what nurses were saying. Now, many authors point to the 1950s as the beginning of geriatric nursing in the United States. First textbook on geriatric nursing was published in 1950, was by Newton and Anderson. The first issue of Nursing Research, which was published in 1952, included a paper on chronic disease in older adults. And that paper was the personal adjustment of chronically ill older people under home care. If you notice a theme here, in the beginning, from the turn of the century to, about the 1970s or 80s, we were quite focused on frail older adults. And that started to change a little bit later, and I'll talk about that in a minute. This was also the time when the American Nurses Association in 1958 issued their Statement on Standards of Care in Nursing Homes. And I'm very proud to share with you that nursing was the first health profession to support national health insurance for older adults. So we have a lot to be proud of here. Now, moving into the 1960s and 70s, we saw more attention being given to older adults and their needs. So some of the highlights include first White House Conference on Aging in 1961. The landmark legislation in 1965 that nationalized health care for older adults, Medicare and Medicaid. The ANA proposed that gerontological nursing be one of its specialties in 1966. And then in 1974, the National Institute on Aging was established at NIH for the purpose of addressing age-related health issues. So geriatric nursing, like all other nursing specialties, has a real proud history of our early pioneers. And these are people who were prominent before the 1970s. I'm going to present just a few of them, certainly not all who deserve to be mentioned here. But I think by selecting a few, I can give you a bit more detail, given the time constraints we have here, a little more detail so that you can appreciate the foundational work that they accomplished. And I think we're going to see that it's very clear that diversity has been one of our greatest strengths over the history of this specialty. So many of our early leaders had served in World War II, and they came back to follow the call of nursing rather than resume roles that were quite traditional at that time. So let me start over here on the left with Mary Opal Willanen. She's a prime example. She had a lifelong interest in psychiatric nursing as well as stroke rehabilitation. A lot of that was attributed to the problems that her husband had. And she is remembered for her classic text, Confusion in the Elderly, Prevention and Care. She also developed one of the first graduate programs in geriatric nursing at the University of Arizona. This is kind of an interesting tidbit about her. She was interviewed in 1980, and she shared her view, and I'd love to hear what you think about this in our discussion. She felt that new nurses should not go into geriatric nursing. Rather, she felt it took a more mature, experienced nurse to deliver the high-quality, skilled practice that geriatric nursing required. She also felt that would give more prestige to the specialty. Now, sharing a little bit of my experience, I met Dr. Willanen at a 1980 Gerontological Society of America meeting. During that time period in the 1980s, nurses were a very small number of people at GSA, and we used to meet in each other's hotel rooms. We didn't have like a large room to meet as a group. And I can remember meeting with about 10 other nurses at the time who were going to GSA. We were in somebody's hotel room, and Mary Opal called me over. She said, "You come over here and you sit down here right next to me on this bed." I thought, oh my God, this, woman who was, such a force in geriatric nursing. She was so pleased that Terry Brower, Ruth Tappan, and I were calling for standalone courses in geriatric nursing at the upper level of the baccalaureate programs, rather than having this content integrated throughout or just offered in Nursing 101 as beginning skills. So I incurred her approval. I was so proud of that. Then moving to the right, we have Doris Swartz, who, like Mary Opal Willanen, she served in the Army Nurse Corps during World War II. She founded the first gerontological nurse practitioner program at Cornell. Now, after a successful rehabilitation following a stroke, she played a real outsized advisory role to the Robert Wood Johnson Teaching Nursing Home project at the University of Pennsylvania. And she's credited for really encouraging Lois Evans and Neville Strump to do their groundbreaking work on physical restraints in nursing homes. Now, I remember as a little postdoc nurse working on that project, and I heard from Lois and Neville what a force of nature Doris was. She really showed the spotlight. She put a spotlight on the problem of restraints in nursing homes because she witnessed this firsthand. And like Mary Opal Willanen, she also felt that the youngest nurses should work with healthy older adults rather than more complex, chronically ill older adults because of how much foundation you needed in order to deliver quality care. In an interview that she gave years ago, she noted that the purpose of gerontological nursing is, and I'm quoting, the preservation of personhood as long as life continues. GSA honors Doris with an award. It's a society-wide award in gerontological nursing research. And Penn State faculty, including Marie Boltz, have been recipients of this award. Okay, moving on to the right here, we have Mary Stark Harper. She was a grandchild of slaves who back in the 1940s, she hitched a ride on the back of a truck to the Tuskegee Institute, and she pleaded with them to let her into the nursing program. They did. And during her senior year of her community health rotation, she was assigned a clinical experience on the United States Public Health Service Syphilis Project. It's better known as the Tuskegee Syphilis Project. And in that study, from 1932 to 1972, the investigators examined the clinical evolution of this disease in 600 African American men with untreated syphilis. Now, be very clear, penicillin was available during this time, but the drug was withheld from these men so the quote researchers could observe the natural progression of the disease. When Mary found this out several years after her graduation, when she learned that the injection she was giving to these men was not penicillin, but a placebo, she was outraged. And this was the impetus that really launched her determination to never let this happen again. So over the course of her stellar career, she worked in the federal government and pushed for the protection of human subjects. Her fingerprints are on every piece of legislation and every regulation that guides our institutional review boards today. But she once said, and I'm quoting, "You cannot control morality and ethics from Washington. It needs to be a local affair." She went on to serve as advisor to 4 US presidents, and she advocated very strongly for the mental health needs of older adults, including those who were in the Tuskegee Project. Mary died in 2006, but prior to her death, someone asked her, "Hey, what do you like to do best?" And she said, "I love to do the impossible." She certainly did. Last but not least is Dr. Lori Gunter. She was my professor in the master's program here at Penn State in adult health and aging many years ago. She's widely credited with developing the curriculum for the delivery of expert care to older adults. Now, she and Carmen Estes wrote the classic text on the topic, Education for what she called gerontic nursing. She felt that nurses needed to know not only geriatrics, the biomedical stuff that's going on with older adults, but gerontology. And she put that together. She was also among the first to argue for professional specialization in gerontological nursing. And it was during the early 1970s that she led the ANA certification process in that area. Now, it's hard to imagine a time when gerontological nursing was so marginalized that it was practically invisible within the profession. But it was in that context that Dr. Gunter brought recognition to nurses who demonstrated excellence in the care of older adults. And I can remember how proud she was of that. She used to talk about that in our classes, that when the nurses came to be awarded their certificates, she said, she said they all thanked her for, you recognize that we have knowledge that not all nurses have. And we're being certified in that area. Now, the achievement of ANA certification was all that more impressive given the odds that Dr. Gunter had to work against. She was a real trailblazer. Her attitude was, you just get back in there and, if you get a rejection on a manuscript or a grant, get back in there. Because she had to do that all her life. She had to overcome barriers imposed by segregation that characterized a lot of the socio-political climate of our country in the 20th century. Graduate schools were closed, a lot of them anyway, to people who were African American. But she applied to the University of Chicago, not too shabby, more liberal, open-thinking university at the time. And they accepted her into their doctoral program, and she actually was awarded a Rockefeller Fellowship. It was here that she met and worked with the eminent psychologist Bernice Newgarden. You may have read about her in some of your psychology courses. She did groundbreaking work on adult development and aging. And so you can see Dr. Newgarden's influence in a lot of the papers that Dr. Gunter published. She is a very strong advocate for interdisciplinary collaboration, not only to advance the science of gerontological nursing, but also the education of nurses who use this knowledge in practice. So they were our very early leaders. The action generation, and this is a term that Priscilla Ebersol uses in her textbook, Geriatric Nursing, Growth of a Specialty. This action generation from 1970 to 1990 are those who really took up the mantle, did the research, and changed policy in practice. So I'm going to throw out a couple of really good references for those of you whose appetite may be whetted to pursue this. Priscilla Ebersol's and Tui's book that I just spoke about, and also 2 papers in geriatric nursing that celebrated their 40th anniversary, which was back in 2020. One paper kind of picks up from where Ebersol ends and talks about early leaders from the action generation to the present. There's also another paper by Barb Bowers that focuses on how geriatric nurses have really been so instrumental in making important policy changes. Now, like I have time constraints, she had space constraints. So what she did was she focused on 3 topics. There are many, many more. But she describes the contributions that have been made to pain recognition in older adults, physical restraint use, and pressure injuries. So I encourage you to take a look at some of those references. I think you'll really enjoy reading about them. Here are just a few other examples of what went on in that action generation. Lori Gunter actually straddled early and action generation. She was the first nurse to present at the International Congress on Gerontology. And she and Jean Ann Miller published a real important paper in nursing research back in 1972. It was kind of a roadmap for how nurse researchers could move the field forward. The title of that paper was Toward a Nursing Gerontology. Just a few of the many action generation. Irene Burnside, people in my generation, that's her textbook, Nursing in the Aged, was really classic, and that's the one we used as graduate students. Virginia Stone from Duke, she developed the first graduate program for clinical nurse specialists in gerontological nursing. It was also during this time that the Journal of Gerontological Nursing was published in 1975. It's had wonderful editors, and the current editor is our own Dr. Donna Fick. And then also during this time in 1980, Geriatric Nursing was published. So a lot going on in the action generation. Now, I would really be remiss if I didn't say something about the John A. Hartford Foundation and its investment in geriatric nursing, because I think this has been, what they've invested has really allowed our specialty to move forward. For those of you that don't know about the Hartford Foundation, it was founded in 1929, and it was committed, it has always been committed to supporting an aging nation around healthcare training, research, and service. Their funding for nursing initiatives started around 1980, and their goal within this initiative was to help nurses build a cadre of geriatric nursing faculty who could conduct research, move the field forward in aging, as well as educate future generations of specialists. So starting in 2001, they established centers of excellence in universities that had a lot of expertise in gerontological nursing. So right out of the gate, in 2001, we had Oregon Health Sciences University, the University of Arkansas Medical Sciences, UC San Francisco, the University of Iowa, and Penn, who were granted funding for establishing these centers of excellence. Then, in 2006, the Hartford Foundation expanded these centers, and 4 more were included: Arizona State, University of Minnesota, University of Utah, and our own Penn State University. Some of the other investments out of Hartford was the establishment of their Institute for Geriatric Nursing at New York University. Matthew Mezzi was the first director. And this center or institute, what they do is develop educational and practice standards, and they're kind of a national repository for policy and practice. So it's a great resource for graduate students to take a look at what is out there. And many of our faculty have contributed to these initiatives. Other support from Hartford included the fellowships and scholarships they provided to graduate students, and we've had a number of students from Penn State that were the recipient of those funds, and their leadership conference that they held every year at GSA. Today, the Hartford Foundation is quite invested in age-friendly health systems, as well as the teaching nursing home. And of course, here at Penn State, we're very much involved in that project. Now, I took this slide from a paper that was written for the 50th anniversary of the Journal of Gerontological Nursing. This paper, our own Nahida Adker headed up a team of us where we looked at all of the editorials that were written and published in Journal of Gerontological Nursing from 1975 to the present. What this gives us is kind of a bird's eye view of what issues were deemed important in our specialty during the last 50 years. So let me just go over a couple of these. Educational preparation for practice and teaching. That has been a consistent theme since 1975. Staffing in nursing homes, still very much a theme. Nursing leadership in practice, policy, as well as research. Encouraging our nurses to be politically active, to change policy. Ageism and how to overcome it. Mental health issues in older adults. Care delivery models, as well as, working with our CNAs. The language that we use to describe older adults, etc., how important that is. Case management. Environmental design. Well, in fact, this past week, we already had a presentation on that in our research meeting here. It was important, years ago as well as today. Health promotion, that started to take a more central role later in the development of geriatric nursing, as people realize, there are a lot of older people who aren't frail, who certainly don't live in nursing homes. We need to learn how to keep them healthy, how to keep them in the community. So that's another topic. Person-centered care and preferences. IT, very important. That's becoming a topic that a lot of focus is on nationally. End-of-life care. Delirium, medication management, behavioral and psychological symptoms of dementia, climate change. That's been important, deemed very important in, I would say, the last 5 years or so. Academic practice partnerships, and of course, artificial intelligence. So, where do we go from here? In that same 50th anniversary issue of Journal of Gerontological Nursing, Star Booker, who was one of our former graduate students, and her colleagues, including Marie Bolz, wrote a very inspiring paper on just that topic. But what I'd like to do now is hear a little bit about your thoughts. What is your vision for geriatric nursing over the next 10 years, or even maybe the next 5? Can't look that far down the road. What are the most critical issues that we should address? Are there any lessons from the past that we should pay attention to as we go forward? Now, how do we get the resources to move our vision forward? Who are our partners? And what are the threats to progress? I am going to share with you a couple of references and resources I mentioned these throughout the presentation, but the last one here, if you haven't gone into our PSU website, we do have wonderful interviews with geriatric nursing educators, a career for a lifetime. I think you'll enjoy looking at those. They really give you a snapshot of geriatric nursing, the history of geriatric nursing education. And so I will end there, but I am going to open this up to discussion. And those questions, I believe Jenny Rank is going to put those in the chat. And we're going to be able to unmute people. So this is your time.
Yeah. Well, first of all, Anne, on behalf of our center and all of our participants, I do want to say thank you before we proceed into the discussion. Such a very informative and fascinating look back at geriatric nursing. So much to think about and consider as we learn from the past and hopefully, move forward. So I did write something into the chat for the group, but just as a reminder to everyone, if you have any comments or questions for Anne, you can put them in the chat, but you can also raise your hand. We would love to have you share your thoughts, especially in relation to her questions, her formatting questions. I do want to give you some feedback, Anne. There's lots of positive comments in the chat about such an inspiring presentation, awesome review. Nice to see that RNs with this certification more in various settings. So Clarice Briggs does answer one of your questions, I believe. She says, we have to keep geriatric nursing in the academic curriculum. It's disappearing in name of passing the NCLEX as quickly as possible. So Clarice, if you'd like to unmute and share more about those thoughts, we'd love to have you do that. Oh, there she is. She's joining us. While she's gathering her thoughts and unmuting there, Jenny's going to unmute her for us. Do you have any thoughts about that, Anne, about geriatric nursing and the academic curriculum and how its relationship to the NCLEX exam?
Yeah, I mean, as you know, Janice, you're very involved too with the teaching nursing home, and boy, that's, a major goal of that project to get, content into the curriculum. And one of the ways to do that is to show both faculty and students how much they can get out of working in a nursing home. And of course, that's just one area of practice. We have older adults across, settings in healthcare. They're everywhere. But, the focus just on passing an exam, I mean, so much of healthcare involves older adults. They're, when you look at who we care for in hospitals, primary care, older adults comprise a larger percentage than any other age group. So it should be, very much represented in NCLEX exams, questions. So I agree with that comment. And I don't know if Clarice wants to say anything else. I think she's still muted.
Does anyone, maybe we can try a chat waterfall activity. And what that means is that I'd love for participants to think about their vision for geriatric nursing over the next 5 or 10 years. Think of a word or a phrase. What would you like to see geriatric nursing look like moving forward? What would, in your thoughts, when you think about a plan for the future, using your wisdom, your imagination, what could it possibly look out like? Chat a word or a phrase into the chat. And again, you can raise your hand and unmute if you'd like to as well.
One thing I might throw out there is, what do you think about artificial intelligence? And is that going to be a help to geriatric nursing, or is that a challenge that might hold us back? I've heard arguments on both sides of the coin there. One is that, if we aren't smart, keeping on top of that, artificial intelligence might be demise of, nurses, that we can have robots, doing the assessments, etc. But then I also hear that it can be very helpful, that using AI to, look at electronic health records, it might bring to the staff's attention, the nurse's attention, of something that the resident or the patient needs. So I don't know how people feel about that. And I think Donna is on a American Geriatric Society committee on AI, or working on that. Maybe, I'll call her out.
Yeah, while people are thinking about your comments and question related to AI, there are a few comments related to some of your other questions that we can take a look at. One is that Kim Bergman-Jackman says that they have a robust program for gerontological nursing in Iowa, but that students are still drawn to ICU and ER.
Mhm.
And I know we see that here at Penn State. When I present to undergraduate nursing students and I ask them what type of nursing they're starting to think about, depending on, where they're at in their progress, very often they perceive at least ICU and ER as very exciting places to work, I think. So it's a good opportunity to remind them that 60% or more of their patients in those settings will be older adults, and encouraging them to keep their minds and hearts open to geriatrics too.
Right.
Donna does comment about lessons learned. She says we need to be brave again, like Dr. Gunter, Mary Stark, and others, and speak up about the importance of diversity, aging with disability, and the importance of a social network for older adults, or a social net. We need to stay a specialty while spreading education to others with age-friendly health systems and other education. Any comments or remarks related to that, Anne?
Oh, well, I think she's right on.
Yeah.
The nail on the head. Extremely important. Older adults are, continue to be a vulnerable population. So, nurses need to be attuned to, those vulnerabilities. We have always been in our profession, and we need to continue to act in their best interest.
Yeah, when I asked people to put comments related to visionary, Marie Boltz mentions inclusive.
Mhm.
So, and Marie is joining us here.
Marie actually raised her hand. So Marie,
Great.
if you want to provide a comment.
Things been covered. I think nurses really should be the ones that are advocating for those that are underrepresented or marginalized. That's what we've done. And now more than ever, we need to continue to do that.
Agreed.
Very strong vision, Marie. Thank you for sharing that.
Mm-hmm.
So Khalid asks for question 4 and 6, which maybe Jenny can help remind us which ones 4 and 6 are. He's saying, do you think health insurance can be a factor? So I think, related to threats as well, possible barriers.
So number 4 was how do we get resources to move our vision forward? And then number 5 were who are our partners?
Mm-hmm. Well, I think the comment that was made, what about insurance for moving our vision forward? Well, just take a look at the past. Again, that's why I presented what happened in the past. We had, a series of programs over the 20th century that really allowed the older adult population to maintain their health or regain their health. I can remember prior to Medicare and Medicaid, older adults just did not get health care. I don't know if any of you do remember that time, but it was pretty scary when you think of it, that, you're just going to have to live with something if you're, 80 years old. There is no money to have, to go to the doctor, whatever. It was a different world. And we've been this generation of older adults is healthier than other generations for a vast number of reasons. But I do think access to healthcare is one of those. So we need to keep that up.
Excellent points. Thank you, Anne.
We do
So
have
Tracy-
another hand raised.
Okay, go ahead.
From Maureen Saxongoya.
Great.
Maureen, you want to unmute? and provide
Maureen
your
is one of
comment?
our friends from the Jewish Healthcare Foundation, as you know, Anne.
Oh, yeah. And thank you so much. I kept trying to chat in and couldn't. I love everything that I've heard about the history and nurse advocacy. I love the questions that you have, because that's exactly what the teaching nursing home in Pennsylvania is trying to work with schools in the care of older adults. So I don't know that I necessarily have a question, though I thank you for focusing in on that. And for anybody on the call, and there's a lot of people that have commented that I am pleased to know, you can join us at the teaching nursing home at any time. I can put the chat in, and I know we're running out of time, but thank you for the chance to talk.
Okay.
Thank you, Maureen. And if anyone is interested in being linked to the Teaching Nursing Home Project, and you can send a message to CGNE at psu.edu as well. Let's see. Tracy says, so hard for this population navigating through healthcare. Sorry, my chat's moving on me. Health literacy is an issue, and they need assistance. Mary says geriatric nursing would be very challenging in the coming years, considering the statistics of older adults increasing, and AI, I guess, would have a role in it, but nurses still need to remain to be compassionate, and AI cannot replace that.
Mm-hmm. I think one of the ways that, and I think that's so true, one of the ways that we can try to help ensure that is to make sure that nurse-sensitive outcomes and patient outcomes that are important to them, what matters, gets into our electronic health records so that we can show the impact that we have. Right now, so much is focused on biomedical types of things. We really need to get quality outcomes more situated in our electronic health records. It's just not there.
Yeah, and having it accessible to those that need it.
Yep.
Sometimes it's sprinkled in the health record, but it's not easy to find. So making that more consistent and efficient. I'm afraid we're almost at the end of our time. And there's so many wonderful comments about this excellent presentation and the richness of learning that we've all experienced today. I do wish we had more time to engage in dialogue, because your questions were fabulous, and I think they're really important as well, so that we can move geriatric nursing excellence forward and continue to improve and enhance what we do. So many thank yous in the chat, and on behalf of myself and our whole leadership team at CGNE, thank you so much, Anne, for this amazing presentation. To everyone, just a quick reminder that the evaluation link will pop up in your browser when the seminar is closed. You can complete it at that time, or you can wait until you receive the email tomorrow. But it does need to be completed within a week if you'd like to receive contact hour credits. Thank you again for everyone joining us today and for your participation in our discussion. Have a great rest of your day.